Hi, everybody. It's so great to see you all. I think the last time we met, there were no leaves on any trees out my window. And today I see a lot of green, which is a wonderful sign. And the weather is a little bit warmer, and that's a wonderful sign too. It's great to be with you today. And we're really pleased for those of you who've tuned in and you want to hear about eye health and everything that goes along with it and your questions. So welcome. We're happy to have you. And I'm going to pass the baton on to Susan Edgman-Levitan, who will introduce everybody and give you your marching orders for how to watch the town hall, though many of you are repeat attendees. Enjoy.
Thank you. So welcome. I want to add my welcome to Dr. Levine. And it is really exciting to see everybody here, especially on a day that's so beautiful. It's kind of hard to be inside. But we're going to have a wonderful presentation today that I'll tell you a little bit more about in a minute, but I have to go through my usual housekeeping items. So the first thing that I just want to make sure that everyone understands is that if you want to just see the speaker, go up to your right-hand corner of your screen and you'll see a little thing that says view, and you click on the speaker view. And that will let you see the speaker. And Dr. Wang has some slides today, so you'll see his slides and you'll see him. If you want to see all of us, then you click on the gallery view. If your picture gets a little jumpy, go down to the left-hand corner of your screen and click stop video, because that will improve your internet connection and may make the pictures that you're seeing of all of us and our speaker a little better. And it'll probably help your sound as well. The other thing I want to make sure that everybody understands is that anything you write in the chat, which is right in the middle at the bottom of your screen, you just click on chat. Everybody on the town hall can read. So we don't want you to write any really specific medical information. We certainly want to encourage you to ask a lot of questions, but we'd rather you not give any detailed medical information about yourself, because you'll be sharing it with all of us. And if you do have specific questions, we really encourage you to talk to your doctor. Make an appointment for an in-person or a virtual visit and see your doctor to discuss them. I'll be monitoring all the questions during Dr. Wang's presentation, and we'll do our best to address as many of them as possible. So with that, we're going to hear from Dr. Silas Wang, who is an instructor in ophthalmology at Harvard Medical School and a comprehensive ophthalmologist at Mass Eye and Ear, which is actually part of Mass General and is actually physically connected to the Mass General Hospital. It sits right in front of MGH, right by Starro Drive. So with that, I'm going to turn it over to Dr. Wang, and let's get started.
Thank you very much. Thank you for having me. Thanks for the invitation. And it's my pleasure to be on this town hall and talk to you all about vision health. Give me a second just to share my screen here. Let's see. Okay, so I think you should be able to see my slides.
Yes.
Okay. All right. So I'd like to talk a little bit about how we can keep our eyes and vision healthy as we age, or for all ages, really. And then talk a little bit about the sort of the big three causes of vision loss as we age, which are cataracts, macular degeneration, and glaucoma. Obviously, there are many other things that we won't necessarily have time for, but to cover these most important topics. And then a few words about living with vision loss as well. So I'd like to start with some misconceptions about eye health that we hear a lot and we read about a lot. And this can help us get a little bit into, the things that we know are helpful. So some of these things are things that that are just a matter of, sort of just not being familiar with eye health. Some of these things are maybe wishful thinking, and some of these are things that there are a lot of hype about, and some of these things are related to people trying to, sell a certain product. We have to take some of those things with with a critical view. So first of all, there's a misconception that you only need an eye exam if you wear glasses or have a specific problem, and that certainly isn't true. There's a lot of things that can pop up that can be detected early on, or even treated early on to prevent problems. So preventative care, just like seeing your primary care doctor on a regular basis, even if you're feeling healthy, can turn up problems that you may not know about and would be helpful to know about early. So a regular eye exam is very important for everyone. We always get a question about whether wearing glasses, reading glasses, or any other type of glasses makes you dependent on them and makes your vision worse over time. Fortunately, that isn't true. It's not true. The glasses don't physically change the eyes. Wearing the glasses helps you see better, which helps you function better. Unfortunately, the glasses don't prevent the eyes from changing, but they don't make the eyes change either. So wearing the glasses when you need them helps you function better, and can help you do everything else better. So you don't have to worry about damaging the vision by wearing glasses too much. But it is important to make sure that the prescription is up to date so that we avoid eye strain and we have the optimal vision. Then we always have questions about whether certain foods, carrots, for example, or whatever sort of food you hear about can prevent vision loss or improve vision. The fact is that there's no specific food that can ward off vision loss, and there's no specific food that you need to eat, tons of in order to keep your vision healthy. The fact is that keeping your body healthy helps to keep your eyes healthy, and so overall healthy diet is more important than looking for that one, quote unquote superfood that you hear hyped about. So eating a general healthy diet, keeping blood pressure, cholesterol, and especially diabetes under control is more important than looking for a specific, a specific food. Then we do get questions about eye exercises. So unlike the muscles, where exercises are helpful in building strength, there's no eye exercises that can improve the vision in a way that you wouldn't need glasses. So unfortunately, it's just not something that's possible. But exercising in terms of keeping your body healthy, just like eating healthy, is an important part of keeping your eyes healthy. So keeping the body healthy is more important than looking for specific eye exercises. Now, a lot of people end up sort of thinking that losing vision is something that's inevitable as we age, although there are many things that can affect our vision as we get older. Some things, some of these conditions we don't have good treatments for yet, but not everyone necessarily has to lose vision as we get older. So there are things that can be treated and can be prevented, and we'll go over some of those things later on as well. There's a lot of questions about using screens, computer or smartphone screens. I will go into that into a little bit more detail, but at least I'll start with saying that the good news is using the computer or screen doesn't in itself physically damage the vision. And that's the same with the blue light. There's a lot of hype recently about blue light from computer screens, although getting exposed to the blue light later on in the day, in the evening, can disrupt the sleep cycle. It doesn't physically damage the eyes or the vision. Some people do certainly feel more comfortable with sort of more natural lighting, filtering out some of that blue light. It's perfectly fine to use blue light blocking glasses if it helps you feel more comfortable, but at least you should know that it doesn't damage the vision. So then I'd like to go on to things that we know are helpful to keep the eyes healthy. And if you think about it, a lot of these are fairly basic things that are important in keeping your body healthy as well. So early detection, as I mentioned, getting your regular eye exams, just like seeing your primary care doctor for a physical exam, is very important in detecting things that can be treated or prevented. And generally, our recommendation for older adults is, even if you don't have problems, every 1 to 2 years. And certainly if there's something specific that needs to be followed, then perhaps more frequently. But even if you don't have problems, even if you don't wear prescription glasses, it's a good idea to have a regular eye exam on a regular basis. Now, smoking is a major factor in damage to the eyes, just like it is for the rest of the body. So it's not just the lungs, but the blood vessels, the heart. Smoking has a lot of effects on every part of the body, including the eyes. And so the number one thing that you can do to keep your eyes healthy and your body healthy, other than if you smoke, is to quit, or at least cut down as much as possible. And your primary care doctor can certainly help with cutting down or quitting. With the eyes, UV protection is very important as well. The ultraviolet light from the sun does cause damage to the eyes and can speed up some of the age-related changes that happen in the eyes. So UV protection, wearing sunglasses, is very important. Also, the physical safety of the eyes, physically protecting the eyes, is very important, especially if you are using power tools or doing yard work or things like that. Wearing safety glasses is extremely important to prevent injury to the eyes. And then keeping your body healthy, as I mentioned, keeping diabetes, blood pressure, cholesterol under control. Things that are heart healthy are also eye healthy. So healthy diet, exercise, good sleep, those things are all very important in keeping the eyes healthy. So as I mentioned, I wanted to talk a little bit about computer and smartphone habits, because this is obviously something that we're spending a lot of time on, for example, right now. The good news, as I mentioned, is that the screen itself and the blue light from the screen don't damage vision directly, but you can definitely develop eye strain. And if you're sitting in one place, hunched over your screen for a long period of time, can certainly get neck and back strain as well. And a common source of problems with prolonged screen time is dryness, because the more you stare at the screen, the more the eyes dry out. And it's natural that as we're paying attention to what we're reading, we naturally blink much less than we would normally when we're looking around at things in sort of interactive, outside life. So making sure that you have the right glasses helps to reduce eye strain, so that things are in focus, so that the eyes aren't straining to focus. Remember to blink, and you can use over-the-counter artificial tears if needed for dryness. And we have something called the 20-20-20 rule, although it's more like a suggestion, but or recommendation, that every 20 minutes, try to take 20 seconds to look at something 20 feet away. So look away from the screen. It helps to sort of reset your body position, helps your eyes to refocus, and gets you to blink and move the eyes around a little bit to help with that dryness as well. Adjusting the brightness and contrast, the color temperature on the screen can be helpful too, to make sure that you feel comfortable, and the position of your computer screen, making sure that it's comfortable. We generally recommend that you keep the screen either at eye level or a little bit down. The more you have to look up, the more the eyes have to open up wider, and that dries out the eyes more. Plus, it becomes more of a strain for your eyes and even your neck if your screen is set up too high. So then I want to talk a little bit about the major conditions that lead to vision loss as we get older. So first, just start with a basic view of the eye, just so that we know what we're talking about. Oftentimes we compare the eye to a camera because they do similar things and have similar structures. In the front of the eye is the lens, just like the lens in the camera. The clear outer covering of the eye, called the cornea, also acts as a focusing element as well. Those of you who have are into photography know that camera lenses often have more than one element. But the lens inside the eye basically focuses the image onto the back of the eye, which is the retina. And this corresponds to the film in the camera, or nowadays more like the sensor, the electronic sensor, which senses the image. And then the retina sends the image to the brain via the optic nerve. And this is like the cable connecting your camera or webcam to your computer. So those are the sort of main areas of the eye that we want to focus on. So starting with cataracts, a cataract is the cloudiness of your natural lens inside the eye. It is the leading cause of decreased vision that's decreased in a way that cannot be corrected with glasses. And so it's the lens is behind the pupil, and you can see some examples of cloudiness. And you may imagine that it's like looking through a dirty windshield or dirty glasses, that it makes your vision cloudy. So I just want to cover some misconceptions about cataract. Cataracts are extremely common, and so are misconceptions about them. The first misconception is that a cataract is some kind of film that grows over the eye and can be peeled off. So unfortunately, the cataract is the lens. It's the natural lens, which itself is cloudy. So in order to fix that problem, we have to remove the natural lens, and we put in an artificial lens implant. So it's basically a lens replacement surgery. There's a term that used to be used a lot, which is sort of the ripeness of the cataract, meaning that the cataract had to be a certain level of, had to be advanced enough to a certain level before you could have surgery. This was true a long time ago, when cataract surgery was not as efficient as it is now. It's not the ripeness or the appearance of the cataract that matters anymore. It's more, how is the cataract affecting your vision, that's affecting your daily life, whether it's affecting you driving or reading or watching TV or what have you. So it's not how the cataract looks or how dense the cataract is, but how the cataract is affecting you that determines when you might need to have cataract surgery. So unfortunately, we do not have any medications or eye drops that can dissolve or reverse cataracts. So at this stage, the only way that we have to treat cataracts is to remove the cataract with surgery. But fortunately, as I mentioned, the surgery is very effective nowadays. The good news about cataracts is that they do not grow back again. Some people develop cloudiness of the membrane behind the lens after cataract surgery and need a follow-up laser procedure. But the cataract itself does not grow back. So once it's gone, you have an artificial lens implant, which is permanent, and the cataract does not come back. Now, not all cataracts necessarily need surgery. Many cataracts can be mild and they can grow very slowly. So just because your, let's say, regular optometrist tells you, oh, you have a cataract, you didn't have that last year, doesn't mean that you necessarily need surgery right away. But it is something to monitor, and cataracts do get worse over time. But some cataracts grow slowly, some cataracts grow more quickly, and that's not necessarily the same for every person. Now, cataract surgery is something that many people think of as something that old people need, and that's not necessarily true. Certainly, because they get worse over time, the older you are, the more likely it's going to become a problem. But many people start developing cataracts in their 50s or even before, and they grow gradually over time. But some people's grow faster than others. So there's no specific age for cataract surgery, and there's also no upper age limit either. As long as you're healthy and the cataract is interfering with your daily activities and activities that you're healthy enough to need to do, then cataract surgery can be an option for you. And as I mentioned, cataract surgery, of course, it is surgery, so there are some risks, but it's not the same as the kind of surgery that perhaps your parents may have experienced decades ago. It's very different nowadays. So just to go over some of the things that people may experience with cataracts. So basically, it's the lens that is cloudy. So the vision becomes cloudy or blurry or foggy. Oftentimes, you may need more light to read. Headlights at night can have glares, halos, and starbursts around them. You can get ghost images or double vision. And because the lens is changing, your natural lens is changing, you may find that the glasses need to change more frequently than they used to. So it's basically these kinds of visual symptoms that may be an indication of cataracts. So I want to mention a little bit about cataract surgery. Many of you may have already had it done. Some of you may certainly know people who have had it done. It's extremely common, 3 million at least done in the US per year, and it has an extremely high success rate. You don't have to stay overnight. You do this under conscious sedation with local anesthesia. You don't need general anesthesia for this. And usually the surgery takes half an hour or less. Obviously, there are always going to be some more or less complex situations. And as I mentioned, you get a permanent lens implant to replace your natural lens. And this artificial lens can correct for some of the things that you would otherwise need glasses for, such as astigmatism or nearsightedness and so on. And usually the eye recovers pretty quickly so that the vision improves over the course of the first week, and you can return to light activity even the same day and driving the next day, and with some sort of restrictions on strenuous activity for a week or so. And most people only need over-the-counter medications for pain. So again, if the cataract is causing vision loss that's preventing you from doing daily activities, such as reading, driving, using the computer, watching TV, playing golf, playing pickleball, whatever, then cataract surgery could be a benefit to you. So it's not just improved quality of life, but studies have proven that cataract surgery helps to reduce the risk of falling and fractures and reduces the risk of getting in a motor vehicle accident as well. So just to sort of switch over to macular degeneration, the macula is a part of the retina, the central part of the retina in the back of the eye, and it is a leading cause of vision loss in older adults, macular degeneration. Early stage may not necessarily have any vision loss, but in the advanced stages can cause a blind spot in the center of the vision. But not everyone progresses to that advanced stage. Unfortunately, unlike with cataracts, with macular degeneration, there's no cure, but some things are known to be risk factors, and so there are ways to reduce the risk. And even if you have macular degeneration, to try to slow it down as much as possible. So it affects the central vision. So fortunately, even in the worst case scenario, you don't lose your peripheral vision. So you can still get around even if you have trouble seeing things directly in front of you. And some of the things that we can see are blind spots or distortions. And this is a Amsler grid, which is a tool that we give people to use at home to monitor for changes. So if you are checking this at home and you see that something new appears, that would be a reason to come in and have it checked out right away. And so you hear about dry versus wet macular degeneration. So the difference is whether there is fluid or blood underneath the retina. Dry is not necessarily always mild, but mild macular degeneration basically starts out with the dry form, and then it can progress to moderate or advanced stages in the dry form. Whenever there is fluid or blood under the retina in the wet form, this is automatically advanced stage. Fortunately, there are some treatments for wet macular degeneration in terms of turning it back into the dry form. And that's where these eye injections are helpful, where these medications help to cause the fluid and blood to be reabsorbed and not accumulate, and helps prevent scarring over time. So as I mentioned, there's no cure, but there are recommendations that can help reduce the risk. Number one is smoking, not to smoke. Smoking is known to be a major risk factor in macular degeneration. So quitting smoking is the number one if you smoke. And then antioxidants, especially dark green leafy vegetables, as well as colorful, your orange and yellow fruits and vegetables can be helpful in reducing the rate of progression of macular degeneration as well, protecting your eyes from the sun, wearing sunglasses, keeping heart healthy as well, keeping those kinds of things also are good for the macula. And then, as I mentioned, the Amsler grid, if you have macular degeneration, check that at home so that you know to come in when there's a change. So there are the vitamins, the AREDS2 formula of vitamins, minerals, and antioxidants, basically containing these elements, which was studied in the there's a variation that was studied in the first ARED study. This is the formula that was it was refined and then studied again in the second ARED study, hence AREDS2, and it has been proven to slow down the worsening of macular degeneration if it's moderate or advanced. So there is a benefit for people who have moderate to advanced macular degeneration to take these this combination of vitamins and antioxidants. Now, they did not find any benefit for people who had mild or borderline macular degeneration or no macular degeneration. So there is no, we can't say that it will help you prevent or not get macular degeneration. For people without macular degeneration, it's generally, in most cases, not harmful to take them, but there's no proven benefit for this. So sometimes they're advertised as for macular health, but really the evidence is really only there for a certain degree of macular degeneration in particular. So then just to switch over to glaucoma, this is a condition where the eye pressure causes damage to the optic nerve. And this is not a pressure that you can feel. So this happens usually slowly over time. And there's no cure, and the damage that happens cannot be reversed, but treatment is available to prevent the damage from getting worse, or if it's caught early enough, you can even prevent the damage from setting in. So this also causes blind spots, but in a different pattern from macular degeneration. Usually it starts in the peripheral vision, and that's where it's more dangerous in the sense that you may not notice it at first. And people can lose a lot of peripheral vision before noticing that there's a problem. And so people can end up with the tunnel vision or even total blindness from glaucoma. Now this picture is a simulation. It's not really black. It's just that there's no vision in these areas. So something is there, but you just don't see it. So the treatment is all about lowering the eye pressure. And so we lower it to a point where the optic nerve doesn't sustain any more damage. And unlike something like blood pressure, where there's a certain number that you can use to apply for most people, the eye pressure target has to be customized. It's not the same for everyone. So there's no, good pressure that's good for everyone. And the more advanced the glaucoma is, the lower the pressure has to be. But fortunately, there's a lot of options that are available. Eye drops are most common, laser, and there are many different types of surgery. And there's a lot of new techniques out there that help to reduce the complications from glaucoma surgery nowadays. So the most important thing is that you can lose vision permanently without ever feeling anything, and that vision, it cannot be recovered once it's lost. So it's very important to catch it as early as possible, preferably before you lose vision. But even if you lose some vision, we can still help you prevent further vision loss. So it's not just the eye pressure, but the optic nerve has to be checked on a regular basis by at least an optometrist or your ophthalmologist on a regular basis. And then just a few words about living with vision loss. Now, this is something that I can say a few general things about, but this is something that really needs to be customized to the type of vision loss. You might imagine that it's very different to have peripheral vision loss versus central vision loss versus, different patterns of vision loss affect people in different ways. But some of the general things that can be helpful are keeping your eyeglasses updated. Even though there is some vision loss and the glasses can't bring back all the vision, at least you optimize the focus of the vision that you have. So keeping your eyeglasses updated is helpful to maximize your vision. Definitely preventing further vision loss, such as glaucoma, where we can prevent it, or wet macular degeneration, where there are treatments. So regular follow-ups with your ophthalmologist are important to detect and monitor your vision loss and help to prevent any further vision loss. Better lighting is helpful, especially where you have problems with decreased contrast. Magnifiers, either handheld or stand magnifiers, or electronic tools nowadays with computer tools, using your smartphone to magnify things. Using audio, such as audiobooks or devices that can read out the time or things like that can be helpful. Again, with computer technology where it is nowadays, a lot of these things are much more available than they used to be. And oftentimes, you can find an app on your iPad or your phone or tablet that can do things that you used to have to get a specialized device for. So there's a lot of things with assistive apps and computer technology that are available that weren't available before. Organizing things at home is very important, not only so that you can find things, but also so that you don't trip over things. Remember, avoiding falls and avoiding accidents is very important, especially as we get older. And so I just want to end with, we have vision rehab specialists, so it's not something that you have to manage on your own. We have specialists in vision rehab. You can think of it a little bit like occupational therapy. They can teach you techniques, get you devices to help with doing your daily activities, and it's in a way that's customized to the type of vision loss that you may have. So I'd like to just leave you with some resources. The American Academy of Ophthalmology, which represents ophthalmologists across the country, has a excellent resource online. As you know, a lot of online resources are not necessarily reliable. So this is written by ophthalmologists for the general public. It's called iSmart. It's www.aao.org/i-health. And they do have a specific section on low vision resources as well. So with that, I think we'll see what, I know there were a lot of things that popped up as I was talking. We'll see what questions have come up, and I'll try to address what I can.
Thank you, Dr. Wang. I think we're going to hear from Dr. Russell for just a few minutes, and then we'll go to the questions.
Excellent, thanks. Can you guys all hear me okay?
Yes.
Okay, do we want to stop sharing? Or are you leaving that? Okay, there we go. Great, excellent. So hi, everyone. I won't take too long because I know that I have a ton of questions that you all have already asked for Dr. Wang. So I'm looking forward to the answers. Just to let you all know, COVID is still out there. We're starting to see an increase in the number of cases. So I'm sure you've seen that in the news. The main goal here is really to say, though, that COVID nowadays is, in terms of how we manage it, is very different from when COVID happened 2 years ago. And many of us are comfortable sticking Q-tips up our noses where we never were doing that before and can test ourselves. What's important to know is that if you are feeling lousy, if you do think you might have been exposed and you test yourself and you're positive, even if you're vaccinated, please, please give us a call and let us know, because we have disease-modifying medicines that can help keep people even from developing severe symptoms. So that's my main focus on the COVID corner. Just to underline what Dr. Wang is saying from a geriatrics perspective, our ability to stay oriented in our world, both physically and cognitively, is inherently linked to our sensory inputs. So anything we can do, even in the midst of deficits around those, to buttress them and augment them as much as we can is key. So this is why sometimes we always say things. I'll have patients that say, oh, I'm too old. Why would I have a cataract repair? Because it's quality of life, because it prevents you from falling, because it keeps you engaged with your friends and family. So that's all I was going to say, and I will hand it back to Susan to moderate the Q&A. Thank you all.
All right, thank you. So we do have a lot of questions. I'm just going to start at the top and go down. So the first one, and I think this is something that many of us have experienced, is about, do you have any suggestions about sunscreen that you can use on your face that doesn't cause extreme stinging and burning? Or maybe just how to avoid that happening or whatever.
That's an excellent question. Although I have to admit that it's more of a question for the dermatologist, since it's not, it's not really an eye product. But my understanding is that a lot of that has to do with the sweat mixing and with the sunscreen and then coming down, dripping down into your eyes. So if you can keep the sweat off, that should help with a lot of the problem with the sunscreen coming down. Sometimes wearing a hat may be helpful instead of, putting on, obviously you do want to apply sunscreen, but maybe that may help to keep the head cool a little bit and maybe help to prevent the sweat from building up as much. But that's an excellent, I mean, that's a common problem, although maybe when you have the dermatologists over, they may have some suggestions for, products.
Great, thank you. So our next question is about Occuvite. Can you say a little bit about Occuvite as a supplement? Is it helpful? Is it not? What are your thoughts about that?
So that's an excellent question. So Occuvite is a specific brand. Preservision is another brand. iCaps, these are brand names. And generally, they do make different products, but generally, we're talking about the AREDS formula. And so, again, the AREDS is proven to be beneficial in people who have moderate to advanced macular degeneration. It's not been proven in people who have no or mild macular degeneration, although I would say that as long as there's no specific problem with any of the particular ingredients, I would say generally it wouldn't be harmful to take it, but even if you don't have macular degeneration, but the benefit is, it may be it's possible that you may just be, wasting your money on that. The benefit isn't proven. Some of the formulas with omega-3s and things like that, unfortunately, those are not really proven for macular degeneration either. Although omega-3s have some evidence for dry eyes, so people with dry eyes may benefit from those. So there are specifically the AREDS formula is proven. Some of the other ingredients and other claims don't necessarily have the same kind of scientific evidence behind them.
Okay, thank you. So another question, our next question is about floaters. Someone has had floaters for about 6 months, was told they would probably go away, but they haven't. Can you say a little bit about floaters, what causes them, and what people can expect?
Sure, of course. Floaters are extremely common and they're extremely annoying. So most people will develop floaters at some point. So fortunately, floaters are not generally related to any of the things that I talked about today, but they are extremely common as we get older. There is a gel that fills the inside of the eye that I didn't really point out, but the cavity of the eye is filled with a gel called the vitreous. And as we get older, that vitreous gel becomes more liquid and contracts in on itself. And so it forms clumps, and we see the shadows of those clumps as the floaters. There are other things that can cause floaters, such as bleeding inside the eye, for example. But when most people talking about floaters, it ends up being these clumps of the vitreous. So this is a material that is naturally in the eye, and it's just formed. It's just clumping together in a way that's causing disturbances in the vision. Most floaters themselves, fortunately, are not harmful, but they can be very annoying. Now, there is a concern that when you develop new floaters, as the vitreous is contracting, it can be pulling on the retina. And so there is a risk of a retinal tear or detachment when these floaters are first forming. And so when you get new floaters, like if you have sudden appearance of new floaters, especially if there's a lot of them, but even if there's just one, or certain other symptoms such as flashing lights or some kind of curtain covering part of your vision, then those would be reasons to see your eye doctor and have your eyes dilated right away to look for a problem potentially with the retina. Now, if there is no problem with the retinal tears or detachments, and these floaters are just sort of chronic floaters, they just kind of hang around, most of the time, most people can get used to them. So they don't physically go away. So when we kind of say they go away with time, we really mean that you notice them less and less over time. Your brain gets used to them and kind of filters them out. So the best thing you can do in that situation is not to pay attention to them, because that allows your brain to sort of subconsciously ignore them. The more you pay attention to them, the more you're actually training yourself to see them. Now, some of them certainly are large and numerous and right in the center and can be very difficult to ignore. There is a way to remove floaters, which is with surgery. So there obviously are going to be some risks with doing surgery. In particular, that kind of surgery will accelerate the growth of cataracts. So you may be sort of exchanging one problem for another problem. So we generally don't recommend doing surgery for something that's otherwise not harmful. But theoretically, if floaters are really bothersome enough to be really interfering with your daily function, it is possible to do. And some people end up having surgery for floaters.
Thank you. Our next question is about wet macular degeneration. Are there any new treatments that do not involve the injections in the eye?
That's an excellent question. For those of you who are getting injections or know people who are getting injections, it's not a pleasant experience, and you have to go frequently to get these medications. Unfortunately, that's the only way of getting the medication to the part of the eye, basically to the retina, that is possible at this time. It's not possible to take it as a pill or an eye drop. It just doesn't get to that part of the eye. But people are working on that. So the ultimate goal is to be able to get the same kind of medication effect without having to inject it directly. And there are things sort of in the research pipeline that are not really clinically, clinically available yet, but be assured that people are working on that problem.
Okay, thank you. What happens if you have cataract surgery and the incorrect intraocular lens gets implanted? How is that handled?
Mm-hmm. So remember that we removed the natural lens and put in an artificial lens implant. And so we try to calculate the power of the lens implant so that the eye focuses a certain way afterwards, but it's a prediction. So we take measurements of the shape of the eye and we predict how the new lens is going to sit inside the eye and how it's going to focus the light. But it's something that has to be predicted with the formula. So there's always going to be, unfortunately, some margin of error with that. And so even if you predict a certain thing, so even at Mass Eye Near, the success rate of getting within plus or minus 1 diopter, 1 unit of the target is about 96%, but that means there's still 4% of people where the result is not what you expect, and that's plus or minus 1 diopter. So that's it's still not an exact science in that sense, because your eye is a biological it's a natural object, and it doesn't always behave the way that we predict. So there's that sense of sometimes we make the best guess with our formulas, and the outcome is not exactly, the focus is not exactly the way that we predict. And then there are some cases where the measurement is something about the measurement or the calculation or the choice of the lens is actually done wrong, where it should have been a different lens, right? The thing is that all the powers of lenses, they are basically the same size and shape. It's just how the eye is going to focus afterwards. So it's not like putting in something that's totally the wrong size for the eye. I guess that can happen, but it wouldn't be common. So then let's say for whatever reason, the eye doesn't focus the way that you expect. Then there are, number one is you can correct that with glasses or contact lenses, although that's usually not what you were maybe hoping for. There is a possibility of exchanging the lens, and this is something that you would want to talk to your surgeon as quickly as possible to do. It is possible to exchange the lens for another one. Although the longer the lens has been in there, the longer you are from the surgery, the more complicated that becomes. Or there is also a laser vision correction, for example, which can be done after cataract surgery to correct for small amounts of defocus that are without having to go back into the eye.
Okay, thank you. Do cataracts always keep progressing once they begin?
So that's an excellent question. So basically, cataracts are a age-related. It's a natural age-related process. So as long as you are getting older, the cataracts will progress. They will not get better. So they basically, it's your that natural lens has been inside your eye. No part of it gets replaced during your entire lifetime. So from the time that it starts forming when you're in the womb, those proteins, I mean, things get added to it as you get older, but those proteins that were there at the very beginning before you were born are still there 50, 60, 70, 80, 90 years later. So over time, there is a natural degeneration, and cataracts do unfortunately continue to get worse over time.
Okay, thank you. A couple of questions that I think are related. Is there any research underway at MGH or Mass Eye and Ear on eye-brain motor coordination, barriers, patterns, behavioral impacts, and how patients learn? And can you also comment further on the vision rehab specialist?
Okay.
Their availability, what they do, that sort of thing.
So first, the vision rehab specialist, we have a specialist optometrist at Mass Eye and Ear. We have a vision rehab department. So anyone who has low vision that cannot be treated, like if you have a cataract, obviously you can do cataract surgery. But let's say you have vision loss from macular degeneration, glaucoma, retinitis pigmentosa, whatever other condition you might have. We do have a department here, and we have specialist optometrists who can help with teaching techniques and setting up, or you can try out and order devices that can help you with that. In terms of the research on sort of the eye-brain motor coordination, that would be more of a sort of neuro-ophthalmic or neurologic, like a neurology kind of question. And I'm pretty sure that this kind of research is being done, but I'm not familiar with the specifics of it, either here at Mass Eye and Ear or MGH.
Okay, back to floaters. When the vitreous gel pulls away, assuming it has a purpose, which it does it leave the eye unprotected from other damage?
That's a good question. So the vitreous it does have a purpose. It provides some structure to the eye, especially as it's forming. Most of that purpose is when the eye is forming when you're in the womb. And actually in adult life, you can actually have the vitreous removed. And we actually do that when we do retina surgeries because it's in the way of us getting to the retina. We can remove the vitreous and it's replaced with basically saline and then eventually replaced with the natural fluid from the eye and never needs to be replaced. So actually the eye sees fine and works fine without the vitreous. So in that sense, just because the vitreous pulls away from the retina, which is called a posterior vitreous detachment, which is what happens when you develop these floaters, it actually doesn't affect the function of the eye, fortunately.
Okay, and I'm going to ask you two questions that I think, excuse me, I've got to turn my phone off, that I think are related. So the first one is, I've read that the incidence of myopia is much lower in pre-literate societies than in the US, Europe, and that Chinese youth have a very high incidence. Is this true? Does it suggest an effect from close eye usage, at least in young people? And then what I think is a related question, which is something I always heard about from my mother-in-law, is you've got to turn more lights on. You're going to ruin your eyes. So does reading with low light really damage our eyes?
Those are excellent questions. So I guess I didn't include that in my slides, but maybe I should have. So just about the light question. So fortunately, reading or doing other tasks in low light does not damage the eyes. So it doesn't physically damage the eyes, just like going outside at night doesn't damage the eyes. So even though you're struggling to maybe a little bit to focus because you have low contrast, it doesn't physically damage the eyes, but you may feel eye strain. It will make your eyes more tired. But physically, it doesn't. Using the eyes doesn't damage the eyes. So, reading in the dark or while lying down or being too close to the screen and things like that, they have other effects in terms of eye strain, but they don't damage the eyes. And then you have the question about myopia. So that's an excellent. It's a big, a very important topic. There's some people refer to that as a myopia or nearsightedness epidemic, because certainly the rates of nearsightedness are definitely increasing, and there's increasing evidence that sustained near work in young people where the eye is still growing may cause some feedback that causes the eye to become more nearsighted. So, I mean, it's not relevant for sort of our age group, but let's say for your grandchildren or whatever, we now do recommend limiting the amount of sustained near work. So some of that is reading, which obviously is important for brain development, but some of that is screen time, which with tablets and phones, which can be reduced. And if you ask the pediatricians, they actually recommend, in many cases, no screen time for the very young kids. Now, there is also a well-known connection between time spent indoors as opposed to outdoors and development of nearsightedness. So whether that's just because of the computer or screen time, or if there's some factor with sunlight or physical activity, it's not exactly known, but kids who spend more time outdoors have a lower risk of developing nearsightedness than kids who spend more time overall indoors. And there does seem to be some effect on that from that sustained near work.
Great. So there's one question, and then I want to turn this over to Dr. Levine, who also wants to make a comment. But the last question is Zidra, I think that's how it's pronounced, more beneficial in the long run than Restasis for dry eyes?
Okay, so yeah, we didn't really get to talk about dry eyes, but as much other than relating to screen time. But obviously, there's many other factors that lead to dry eyes. Dry eyes is, kind of sounds like a more of a trivial concern, but it's actually a major problem in terms of quality of life for a lot of people. And there's a lot of factors: computer use, weather, hormones, just age, medications. Many factors that contribute to dry eyes. And so the question between lifitegrast, which is Xiidra, and cyclosporin, which is Restasis, these are both medications that can help to reduce the signs and symptoms of dry eyes. And there's, as far as I'm aware, no specific head-to-head trial. So we can't say specifically whether one is necessarily better than the other. And people's results do vary. And some people who do well on one and have trouble with the other, some people do better with the other and have trouble with, and some people do better, do well with either one. So that's something that's a little more specific that would be good to talk to your ophthalmologist about your particular situation.
Great. So I'm going to turn this over to Dr. Levine, who wants to make a comment.
Hi, everybody. Can you hear me okay?
Yes.
I'll add one other thing. I would think that the majority of problems that people come to us in primary care geriatrics is for dry eyes. And it's important to know that there are many medications that can cause dry eyes that people are taking, especially a class of drugs called anticholinergics that relax the bladder, amlodipine, which is a very Norvasc, which is a very common blood pressure med. So when you have dry eyes, talk to your primary care doc and talk about that. But that's not what I wanted to talk about. What I wanted to talk about is that having made house calls for 30 years, it's really important, Dr. Wang mentioned this, that there are occupational therapists who specifically train for people with low vision. And they can go into the house, they can go into the home. The Commission for the Blind in Massachusetts has a lot of these services, and they can see what in your own home would make vision better. Where would you put a magnifier so that you can read your bills? How can you get a device that will allow you to read the prices when you go out shopping with a magnifier on a stick that will reach a high shelf? How can you fill a cup of hot water and put a sensor in it that says, okay, time to stop filling it in, stop pouring because the cup is full. And things like talking clocks, talking scales, talking glucometers for people who have diabetes, and all kinds, and now even, and we didn't even go into this because this is real world stuff, but it seems like the future is artificial intelligence. You can hold a camera up to a room and it will say, there are 6 people sitting here, 2 women and 1 man, or someone is sitting to your right, someone's sitting to your left, and or can read things on a bill and speak it to people. So there's all kinds of fancy stuff around. And those of us who are the docs and stuff like that, we focus on the medical things that we can do and the surgical things, but occupational therapists know all kinds of stuff that where it's really in their bailiwick and very much worth either having it done in clinic if people are mobile, but actually to look at somebody's home and see what they can do in the home is incredibly valuable and life-changing, including talking medication dispensers, all kinds of stuff. So just wanted to make that point too.
Great, thank you. Well, I think we are almost out of time. I just want to check in and see if Dr. Russell has anything else he'd like to share.
I did just want to, I got a question in the private chat just asking about the next variant of COVID is coming up. I don't know that it's the next variant that's happening, but there is an upswing on the incidence of COVID in Massachusetts. We're seeing that. So remember, before we ever had vaccines, we had, and the treatments for the virus, we had masking, social distancing, and hand hygiene. So this is one of those times that even though the weather is getting nicer and you'd love to go into and go out, keeping that in mind is really important. So I hope that answered the person's question. And other than that, stay well, and we'll talk to you soon. And I'll hand it back to Susan.
All right, thank you. We did get one last quick question. I don't know if it's a long or short answer, but are there treatments available for pseudoholes?
I assume that that's for a macular pseudohole. I'm not, it's not sort of a specific term, but people with epiretinal membranes can develop lamellar holes or non-full thickness holes, and most of those don't need to be treated, but some can be treated with surgery. That's kind of a more sort of specific to your particular situation. So that may be something that you would want to see a retina specialist about, if assuming we're talking about macular pseudoholes.
Great, thank you. Well, thank you, Dr. Wang. This was really informative. I got a lot of my personal questions answered. So thank you, and thanks to everybody that participated today, because I think we had really great questions. And you're getting a lot of thank yous in the chat, if you can take a look. So it's our pleasure. And we will see you all soon. Stay well and stay safe.
Thanks everyone for attending.
Yeah.
Thank you. That was
Bye-bye.
great.
Thank you.
And somebody just posted that Mass Eye Near does have an emergency room with ophthalmologist in case you have any sort of ocular or eye emergency. So, or a hearing emergency, because I'm sure your emergency room sees everything related to the
Yeah.
eyes, the ears, the nose, etc.
Exactly. Eyes, ears, nose, and throat. Yes.
Yeah.
And there are some things that certainly, if it's specific to that part of the body, it may sometimes be more worth it to come in. If it's an emergency, to come into the Mass Eye and Ear emergency, as opposed to sort of the local community hospital where they may not have the specialists and the equipment. If it's specifically an eye, ear, nose, and throat problem.
Great. All right. Thank you.